and then, you know, the world, it would follow the rest of society, the rest of the way the country works. And I observed that, and you know, these aren't easy words in opposition, because I didn't like what was happening. And in government, I said, you know, what we needed to have was a policy of NHS preferred provider. That's not to say there's not a role for others in helping provide health services, but I see it as a supplementary, additional role, not as a replacement role, which others did see. And I think it is, you put your finger on something really important. That's the crux of it, really. If you allow this kind of silent kind of thing to carry on, where people just allowing this marketisation to increase, it will destroy it. It will destroy the NHS in the end. Before the people of this country will know, it will have gone, and they won't have ever voted for it. They won't have ever asked for services to be provided in this way. The big one to go will be the commissioning support units. They are being lined up for privatisation. They are being, you mentioned all of these organisations coming in to help the Department of Health. Well, they are now looking at and sizing up these commissioning support units, which are on a path towards privatisation in 2016. Now, for those who don't know what they are, these are often ex-PCT staff. You know, the PCTs that were hollowed out have now been brought together in these blocks, and they are going to be, and this is decision-making or advice on decision-making in the NHS. How can that be privatised? You could, you know, of all things, you can't privatise public decision-making, surely, but that's what they're planning to do. So it's under attack from every single angle. And I look back at, you know, the Health and Social Care Act will be repealed, the Secretary of State's duties will be restored. NHS preferred provider is what I am arguing should be the centrepiece of that bill, because I don't believe actually, and then commissioning I want to see in the hands of the Health and Wellbeing Board, because while I can defend GP involvement in commissioning, which is a good thing, I think in the end GP domination or control of commissioning is definitely a bad thing. And that's why that also has to be stopped before it takes too much hold over the system. So you make very powerful points, but you describe the scale of the challenge we've got. In terms of make a coalition with the community, you're absolutely right. I think that's what we've got to try and do through these elections, helping in the London elections, helping Lucy and others in the European Parliament, and then on to Neil's election next year. We've got to make this a kind of, not just a Labour Party fight for the NHS. This has to be a fight that pulls everybody together who's worried about what's happening to the NHS. And you know, I think there are signs of that, really. I mean, the Lewisham campaign was an illustration of that. That was a coalition of everybody in that community, and by God did it use its voice very well indeed. And that's the kind of thing I think we need to see over the course of this year. And we need our trade union partners, absolutely. Well, we're working very closely with them. And I think I'm right in saying, you talk about the fight that you had in Colombia. Unite, I think it's Unite, have been de-recognised in West Yorkshire, haven't they? By Yorkshire Ambulance Service. NHS organisations are starting to de-recognise trade unions. Now, if that isn't a warning about what's going on out there, you know, Yorkshire Ambulance Service de-recognise Unite. Now, that is unprecedented, because in our time, it was always based on social partnership. The NHS, the unions and the government together. Now that's breaking up. So you're absolutely right. There's a march for the NHS later this year. There's lots of activity building up from grassroots level. And the Labour Party mustn't kind of that mustn't be happening over there and the Labour Party over here. With them leading that. And that's what I'm working on, but your point was well made. In terms of feeding information in, I think you're absolutely, we could get better, I'm absolutely sure. The Shadow Health team run a regular report called NHS Check, which is a snapshot of what's going on in the NHS. You know, we've done them on postcode lottery, on rationing of services, we've done them on privatisation, on A&E, we've done many on A&E, and you know, opposition can be frustrating at times that you do this work and it doesn't always get heard, but you know, we want people to tell us what's going on, and we do have a network out there of people who are feeding in things to us. But you know, if I could talk to you afterwards, if we can make that even better, then I'd absolutely be happy to do that, as well as spot what issues are not issues. as far as I'm concerned, GP access is the issue for most people in terms of, you know, I know there may be plans in London, but, you know, it's been absolutely hollowed out, general practice around the country, and I think in terms of most people's real experience of the NHS, that's what they experience first, the difficulty in getting a GP appointment. And I think that is people's major frustration as the way things are at the moment.
Thank you. I'm just